Welcome to the Pediatric Healthcare to Support Student Attendance Family Awareness Event through Children's National. If you are joining us today in person or watching this recording, we appreciate your time in learning more about pediatric healthcare at your child's school that's provided by Children's National. Today, we're going to learn how to enroll your student in programs to support your child's health and attendance. For joining this full event in person or through viewing the recording, there is an opportunity to receive a $25 Target gift card for the first 100 people, and more information will be shared at the end of this event.
And welcome to this important family awareness event. We're happy to have you here. My name is Andrea Allen. I'm the Director of Student Attendance at DC Public Schools. My team and I primarily focus on improving attendance outcomes for our students. As we know, attendance is a huge priority for the district, right? That students who miss as little as 10% or more of school days, excused or unexcused, are at risk of learning loss, not graduating on time, or graduating at all. It is important to DCPS that our students are in school learning and participating and having connections that are important to us and to them, and created only where in the school building where it can participate, only in the school building where students could really access this information and this connection. Given this, DCPS is really excited about this Children's National Hospital School Partnership. And today we're here to learn more about it. And so I'm happy to turn this back over to Children's National so they can share more about it. And we're happy to answer any questions you may have, because we really want you to connect and partner with us in improving attendance. Thank you.
Thank you so much, Ms. Allen, and thank you so much to you and your team for all that you're doing to support students throughout the district. At Children's National, we are committed to working with our school and health partners so that we can meet the needs of students so that they can succeed in school and in life. We know that if we are working together with the school system, we can better align our resources and our support for children and students so that we can improve academic and health outcomes. And we want to help ensure that there are no physical or mental health barriers standing in the way of a child being able to attend and participate in school, and to be sure that we are meeting those children's needs. So we're going to tell you today about some programs that you have the option to enroll your student in order to help support student attendance. I'm going to turn it over to my colleague, Dr. Jaytoya Mangit, to tell you about the first program. Thank you.
Hello, I'm Jaytoya Mangit. I'm a healthcare provider at Children's and one of the staff members of the CARE-H team. So I'll be speaking with you about our program and its mission. So CARE-H stands for the Collaborative for Attendance, Resources, and Education and Health. So the mission of CARE-H is to provide resources between the public schools and the healthcare provider. So it's a partnership between your child's school and your child's medical providers that will help support student health and reduce absenteeism. Again, our mission is to ensure that your scholars are as healthy as they can be and spend as much time in the classroom as they can. And how CARE-H works is that parents, you will give permission to the school to share attendance information with your child's doctor, nurse, and medical office via a secure information exchange. We, the staff members of CARE-H, then use this information to provide outreach each month to the families so that we can help connect you to resources and medical resources that help your children stay in school. Some examples of the resources beyond the healthcare clinic that we help connect you to are housing, food resources, transportation resources, things that we know may impact attendance. In addition, because we are your medical home, we can also connect you back to our clinics and subspecialty clinics as well, if we find that the cause of absenteeism is due to a medical reason. So the overall scheme of how Care H works is that you all sign up in this registration packet, and then the information is shared to our Care H team securely each month. And this is any absences that your scholar might have had in the prior month. From there, our healthcare team does outreach to provide you with the resources that you may need to ensure your scholar spends as much time in school as possible.
Hi, I can take over from there. I'm Dr. Julie Kruger, and I wanted to just talk a little bit about the school-based health centers that are available in the district. So we can talk a little bit about what school-based health centers are. So school-based health centers are comprehensive primary care clinics that are located right within the schools. This gives you easy access for your students and scholars to be able to see a provider and meet their needs right there in the school setting. The overall goal of a school-based health center is to improve access for these students to healthcare services, and therefore be a healthier individual overall. This makes a stronger student and a strong learning environment. And that is the goal of all of us in this program. Children's National operates 2 school-based health centers in the district, but I do want to highlight that there are others that the DC Health team oversees in the city. So Children's National is currently in the Dunbar Senior High School and the Ballou Senior High School. I do want to mention that the other schools that the school-based health centers are in the city are at Anacostia Senior High School, the Cardozo Learning Center, Coolidge Senior High School, Roosevelt Senior High School, and Woodson Senior High School. All of these sites have providers who can see the students during the school day. These support the nurses and help to get any needs met, which we'll talk a little bit more about. So services are very focused on adolescent healthcare needs because all of the current school-based health centers in the district are in high school settings. This means that they provide primary care just like a doctor does in the rest of the city, and preventive care. They also focus on reproductive health needs, mental and behavioral health, dental care, your vaccine and immunizations, sports physicals, as well as they're able to address any urgent needs such as injuries or other things that come up for a student during the day. I want to talk a little bit about how the school-based health team can be your medical home, but they also don't have to be the only doctor you see or provider that you see. You can see a pediatrician or medical team outside of the school-based health center, and then also be part of the team right there at your school. We definitely want to work together with your provider if you see someone outside of the school. I also want to mention, we're going to talk a little bit about consents in a moment here for all the programs. The school-based health centers, their consent process can be obtained in a few different ways. They're available on the DC website, but they can also be picked up directly inside the clinic from the healthcare team at Ballou and Dunbar. They can provide you those consents to a parent or a student when they come in. And also when you enroll in the school, your enrollment forms at the school's registrar themselves can have the consent process to enroll in your school-based health center. And I'll let the rest of the team talk further about the other consents from here.
Thank you so much, Dr. Kruger. So families are may have seen already this year that the DC Thank you so much, Dr. Kruger. So families may see this year in the DCPS enrollment packet that there are multiple consent forms that you can complete in order to enroll in the Care H, or Collaborative for Attendance Resources in Education and Health programs. as well as the school health services programs for vision and hearing screenings in schools. So please refer to your DCPS online enrollment packet where you can find the enrollment forms as well as more information. Your consent form is valid as long as your child is enrolled in DCPS, and you can remove consent at any time by notifying the school in writing. And these are just some screenshots that illustrate some of the consent forms that you will see that are new to the registration packet this year. Just a brief example of how some of these programs and outreach can help students and families. With the Collaborative for Attendance Resources and Education and Health, one example is we were able to identify a teenager who was missing many days of school. And when we connected with the family, we found out that he was really experiencing significant anxiety about attending school in person. And we were able to connect that student and family to mental health consultation and treatment so that the student could return comfortably and safely back to school. So we know that families have a lot going on, and we are here to help connect you to resources that may be helpful and remove any barriers to school attendance. And as one parent said, "Thank you so much. This is another layer of support and connection to resources. Thank you for fighting for my family."
For parents and guardians that are here today, or for those that watch the recording, we really appreciate your time and taking the opportunity to learn more about what programs are available for your child. Please complete this feedback form. You can use the QR code to open the form. You can use your phone and take a picture to open that. The first 100 people will receive a $25 gift card via email. And so we need to collect your information in that feedback form. We just wanted to say thank you so much for your time today. Here is an email. If you have any questions or need more information, please don't hesitate to reach out. Thank you so much. Have a good day.